thank you so much for your kind invitation. Thank you to the DAR team for inviting me to talk on fasting practices in people with CKD and diabetes. My name is Tahseen Chowdhry. I'm a diabetes consultant at the Royal London Hospital in East London, UK. I hope to give you over the next 15 minutes a brief reminder of the DAR practical guidelines for 2021 for patients with diabetes and CKD, and then just talk you through some of the results of the DAR 2020 survey with particular reference to patients with diabetes and CKD. These are data that have recently been submitted for publication. And then we're going to consider how these results may inform the DAR guidance for the future iterations of these guidelines. So these were the guidelines that were published in 2021. I was involved in the renal side of things, and I think they have been very well received and very useful. And I certainly use them. I'm currently using them for my patients as I'm seeing them prior to Ramadan 2023. So this is a typical case that I might see in my clinic in East London. So this is a 66-year-old gentleman with long-standing type 2 diabetes. He has quite severe CKD stage 3B, and he has ischemic heart disease. He's on insulin. He's on a number of cardiovascular drugs as well. He has fairly moderate glucose control. He has significant renal impairment. And he says to me, he wants to fast. I've fasted for over 50 years. I've never missed a fast. What's the advice that we should give this gentleman? Well, clearly, I'm sure you'd agree that this gentleman appears to be quite high risk for fasting in view of his CKD, his insulin therapy, his ischemic heart disease, etc. What's actually in the literature regarding this? Well, and sadly, the literature isn't very informative at the moment. What we think is that what we know is that fasting may cause hypo or hyperglycemia in people with diabetes. In people with CKD, it may cause dehydration and possibly a fall in blood pressure and reduced renal plasma flow, possibly a predisposition to acute kidney injury, and possibly an increase in cardiovascular problems related to thrombosis and hyperviscosity. The guidelines that we published last year on the management of diabetes and CKD in patients planning to fast was not really based on good evidence because of the lack of large-scale studies, and most data that we looked at involved studies that were small and uncontrolled. I'll share one study with you that I was involved in Ramadan 2018, which was a fast duration of 18 hours. This was the East London Ramadan survey. And what we looked at was people with type 2 diabetes, CKD stage 3 in East London, and we offered them counselling on the risk of fasting, and we discouraged them from fasting, but many people decided to fast, and we divided them into fasting and non-fasting groups. The people who fasted underwent Ramadan-focused education and proactive reductions in medication, and we followed up about 139 patients during and after Ramadan. And what we found was that there was no significant difference in the change in renal function. There were no adverse events such as hypoglycemia, acute kidney injury, or cardiovascular events. And despite actually advice not to fast, many of our patients decided they wanted to fast, and they were able to do so safely. But I think really importantly, and actually if you contrast this to the DAR survey, all of these patients underwent Ramadan-focused education and proactive reductions in medication. I think that's a really important point to compare with the DAR survey. So the DAR recommendations that we published last year for fasting in patients with CKD, we recommended that all patients with diabetes and CKD should discuss their fasting intentions with their specialist team. They should be discouraged from fasting, particularly if they've got cardiovascular disease. The theoretical reduction in renal function wasn't seen in many studies that we looked at. But what we suggested was that some patients with stable CKD may be able to fast, providing they were given proactive Ramadan-focused education and adjustment of anti-diabetic therapy. In people with more severe CKD, so with people with CKD stage 4 or 5 or on dialysis, then we suggested that fasting should be strongly discouraged. People with stable renal transplants, if their renal team were happy, then they could fast according to their advice. We advised all people with diabetes and CKD that if they plan to fast, they would drink plenty of fluids, undertake daily measurements of weight, have a check of their kidney function in the middle of the fasting month, and avoid foods with high potassium and phosphorus content. So what about the CKD cohort in the DAR survey from 2020? Well, this was conducted in a number of countries. As you can see, adults with type 1 or type 2 diabetes who fasted during the month of Ramadan were recruited during 2020, and they had a routine consultation post-Ramadan between June and August 2020. Data with gathered via a survey monkey questionnaire looking at demographics, fasting intention, and number of days fasted, symptoms of hypo or hypoglycemia, and attendance at the emergency department or admission to hospital. You can see the definition of hypoglycemia there, greater than 300 or 16.7 millimoles per litre, or the presence of diabetic ketoacidosis or hyperosmolar hypoglycemic state. And hypoglycemia was a glucose less than 3.9, and severe was defined as requiring third-party assistance or a visit to the emergency department. There was over 6,500 patients surveyed, of whom about 10.5% had CKD, of whom the majority had type 2 diabetes, as you can see there. So going through the results with you now, what you can see is that patients with type 1 diabetes, of course, had a lower age, approximately equivalent gender distribution. People's glycated hemoglobin was quite poor, as you can see. Type 1 diabetes and HbA1c median was almost 9% in type 1 diabetes. In type 2, it was 8.7%. The duration of diabetes was approximately the same. And if you look at the treatment in people with type 2 diabetes, you can see that a significant number of them were on treatment that could cause a hazard for hypoglycemia. So almost 70% on insulin and 30% on sulfonylureas. Did you do self-monitoring of blood glucose during Ramadan, or did you have diabetes education? These were some questions that were asked. And you can see here between type 1 and type 2, most people with type 1 were testing the same as they would normally. About 20% were testing more frequently. With type 2 diabetes, about a quarter, approaching a third of patients were not testing at all. A number of patients were testing about the same as they were previously. I think this is a bit of a concern around the question of education. So you can see here that only 53% of people with type 1 diabetes received some education, around about 30 minutes or so of education prior to Ramadan, and a similar number of people with type 2 diabetes. 56% of them received education, about 20 minutes of education, as you can see. And that, I think, is a big concern. So, I mean, approaching 45% of people did not receive education regarding Ramadan fasting, which I think is a concern that we'll see reflected in some of the data subsequently. So what about hypoglycemia? That's the big concern that we have. So comparing people without CKD compared to people with CKD, you can see here significantly more people with CKD had hypoglycemia during the daytime, and that was a significant p-value. Did you break the fast because of diabetes-related illness? Significantly more people with CKD did compared to people without CKD. So around 30% of patients broke the fast because of a diabetes-related problem. Similarly, hypoglycemia, so we've mentioned already, significantly more with CKD, and visits to ER or hospital admission, you can see here that was significantly higher in people with CKD compared to people without CKD. Hyperglycemia was also significantly higher in people with CKD compared to no CKD, but actually hospital admissions or ER visits due to hyperglycemia were not significantly increased amongst the CKD cohort. What about looking at the CKD cohort according to type 1 and type 2 diabetes? Well, I think this is, again, a bit of a concern. So the people with type 1 diabetes, there was much more hypoglycemia amongst those patients. You can see here also, I think a bit of a concern is that 82% broke the fast as a result of hypoglycemia, but of course that means that 18% didn't. Similarly, you can see here with the type 2 diabetes, hypoglycemia, did you break your fast during Ramadan? So 30% didn't. And You can also see here the hyperglycemia data. So around about 43% of patients with type 1 diabetes had hyperglycemia, but attendance at emergency departments was not significantly different between type 1 and type 2 diabetes. So to summarize those results, people with CKD had more frequent hypoglycemia compared to people without CKD. And that actually is fairly unique results compared to other data that we've seen, especially in people with type 1 diabetes. Most of these episodes, actually drilling down at them a little bit more, were between midday and iftar, so in the late afternoon. And actually, also importantly, most of these episodes were in the first week of Ramadan. And that perhaps suggests that people were not proactively reducing their therapy prior to Ramadan, and that lack of education may have been the factor there. So severe hypo or hyperglycemia requiring ER visits or hospital admissions were higher amongst patients with CKD. And again, that's a unique finding to this survey. We have had one previous study which shows an increased risk of hypoglycemia based on Freestyle Libre sensor monitoring, but most were mild and no reports of severe hypoglycemic episodes. So a bit of a concern from this survey. 40% of patients with diabetes and CKD did not discuss fasting with their healthcare professional or undertake Ramadan-focused education. I think that's also a big concern from this survey, is that actually a number of patients who are high risk of hypoglycemia have not undertaken education. So does this inform our recommendations? So looking back at the recommendations from 2021, I think the first recommendation, discussing fasting intentions with their diabetes and renal team, clearly applies very clearly. CKD is a high-risk state for fasting, and people should be discouraged from fasting. I think that also applies, because particularly if they have other comorbidities, they may well be at risk of hypoglycemia. Deterioration in renal function was not borne out by this survey, but an increased risk of hypoglycemia very much was. And some patients with stable CKD may be able to fast. I think that probably is true, but if they do fast, then they must have that Ramadan-focused education and adjustment of anti-diabetic therapy, if possible, prior to fasting for Ramadan. So the conclusions of this survey is that CKD in people with type 1 or type 2 diabetes is a high-risk state for fasting during Ramadan. I would suggest, particularly with people with type 1, that the risk of hypoglycemia is very severe, and we should strongly discourage people with type 1 and CKD from fasting. Hypoglycemia is the main risk. And if people insist on fasting, then they should undergo careful education, test their glucose regularly, and be advised on the dose reductions of medications which may induce hypoglycemia, particularly insulin and sulfonylurea. Thank you very much for your attention.